Now, the Human Sciences Research Council will conduct a study looking at how frontline healthcare personnel manage their own physical, emotional and mental well-being during the COVID-19 pandemic. In South Africa, over 300 healthcare workers died of COVID-19 related illnesses between March and November last year, with most deaths occurring in the Eastern Cape, KwaZulu-Natal and Gauteng. Now, let's discuss this further. We're joined via Zoom by Dr. Allanise Cloete from the Human Sciences Research Council. Dr. Cloete, thank you so much for your time this afternoon. Now, please tell us a little bit more about this study and how it's different from the study that was conducted last year.
Okay, thank you for that question. So this is a qualitative study. So as you've mentioned, we're doing the study to gain an in-depth understanding of healthcare personnel experiences in managing their own health and that of the ones that they provide healthcare services to. So we're looking in essence of exploring the lived experiences, the challenges and the vulnerabilities of being on the front line of this pandemic. The study is different to the survey that was conducted last year because it's qualitative. It's not meant to be a representation of healthcare workers across the 9 provinces of South Africa. In fact, we're doing the study only in the Western Cape, in Gauteng, and in KwaZulu-Natal, since these are also the provinces that have borne the brunt of the COVID-19 pandemic. So it's very important that following the big survey that was done last year in wave 1, that this time around we're aiming to provide a more nuanced understanding of the challenges that healthcare workers face amidst the pandemic.
I'm sure you've been following just some of the reports that are coming on the ground in terms of those numbers. I mean, what's the main aim of the study and how many people are you targeting in this latest study?
Okay. So this study, like I said, is a qualitative study. It's not meant to be a big survey. So really small numbers of healthcare professionals that we're aiming to include in our study. Between 7 to 100 healthcare personnel across the 3 provinces. And the main aim of the study is to gain a more in-depth understanding of what it means to be on the front line, how are healthcare workers coping with the stress and the anxiety that comes with being on the front line of the pandemic.
Now, we've heard from different institutions from the healthcare industry side, from the medical association to the nursing associations, and we can already tell that this group of people have, because of being in the front line, have been severely affected. I mean, we also understand now that more help is, on the cards. We've seen military personnel being deployed. Do you think, just judging from the survey that you've done previously, this will come as some sort of much needed help, or is it a case of it's too late?
Well, I think that this time around, and being in the midst of wave 3, it becomes extremely important to again explore how healthcare workers are able to manage and what factors contribute to the anxiety and stress amongst healthcare personnel. In wave 1, as you know, we conducted a survey amongst over 7,000 healthcare workers, and this time around we're looking at how are healthcare workers coping with the psychological distress with working within an environment where they put themselves at risk. We know in wave 1 that healthcare workers, and in particularly nurses, were fearful of passing the virus onto their family members. In wave 1, we also know that there was a lack of training in dealing with infectious diseases. At that time, there was also a lack of training in the use of PPE. So we know that with nurses in particular, they were working under severe psychological distress. And so it becomes important to look at how healthcare workers are coping and dealing with their health and the ones and their loved ones within the pandemic.
Are you going to, once you've concluded this study, going to send, recommendations to, just the various associations that we've mentioned earlier in terms of what can be done to assist nurses? I mean, you speak of the first and the second waves. We are in the third, wave at the moment, and it's probably one of the most severe of the two that we've heard from authorities. Just some of the recommendations that you think that you will be able to provide.
So some of the recommendations is that we think that we'll be able to make following this qualitative study is to have more training that is needed to offset the sort of lack of confidence in the knowledge of COVID-19. Specific training on how to deal with the psychological distress. We know that there are supposed to be systems in place that would provide psychological support to healthcare providers. The extent to how well this is implemented and how well healthcare providers make use of these services are unknown. So we're hoping to make recommendations on some of the psychological support services that are needed for healthcare workers.
Dr. Cloete, as we conclude and wrap this interview, perhaps as a Human Sciences Research Council, you've done other surveys that fall outside of the healthcare, workers side of things, like maybe, just how citizens in the country are currently, dealing with this pandemic. We've heard numerous times the phrases of COVID fatigue being thrown around, and that to a certain extent is being blamed for the high numbers that we are currently experiencing. Just maybe if you can give us some insight in terms of other studies that you have done that specifically speaks to how South Africans are dealing at the moment.
Okay, so in wave one, we did a big survey in the general population, and it was felt at that time that citizens were fearful how to engage within the healthcare setting, but also how to live their lives. There was extreme distress from the members of the general population in terms of access to work, access to income. We know that a large proportion of South Africans make use of informal trading. And so that was some of the big concerns and the big challenges that South Africans were dealing with at that time. So this time around, we're also hoping to launch the 1 year later survey, and we will assess how South Africans have managed coping with the disease, and what are their perceptions and knowledge and attitudes towards vaccination. And the 1 year later survey will be launched after completion of this qualitative study, and that will be a survey that will be conducted online, as was done in the Wave 1 survey.
All right, Dr. Cloete, thank you so much for your time this afternoon. That was Dr. Allanise Cloete from the Human Sciences Research Council. They're currently, doing a number of studies, and the first one we will be looking forward to is that healthcare personnel study that they are currently doing. Thank you so much for your time.